Sophie is recovering from Hodgkin's lymphoma for a second time. She's immersing herself in an art installation of hundreds of lights, each individually controlled, putting her into a different world of sights and sounds. And this is in the Oncology unit in Cheltenham, where she recently finished her treatment.
For me, colours are everything. So this, I wish I could just pick it up and take it home with me. It's just shifting your mood instantly because I'm so attracted to colours and shapes, and especially with the effects and the nature effects. This is amazing. I could walk around here all day.
These installations are known as Submergence, and another one is being installed at the Children's Centre at the Gloucestershire Royal Hospital. They're being used as part of a research project to see if they can help patients faced with the stress of hospital admissions and treatment.
We're hoping that having artwork and installations like this in healthcare will help us to provide nice experiences for people when they're in an otherwise bad place, perhaps to take them away from their situation, to make their experience as a patient much better. Ultimately, we're hoping that that also has an impact on their well-being, their mental health, and thus may help to reduce NHS costs.
For several weeks now, patients and their families have been asked how Submergence makes them feel, to see whether it's had a positive effect on their mental health and well-being.
When you're in hospital, you feel quite lonely quite a lot of the time because you can't have people constantly visiting you, so it's good to come down somewhere like this and distract your brain a little bit, doing something a little bit different. I've been in a few different hospitals over the time that I went through my chemotherapy, and when it is a place where it's a bit more colourful, there's art on the wall, there's something like this going on, it makes it a lot more comfortable for you.
Calming. I like looking at the lights of different colours, very relaxing.
Do you feel different when you come out?
Yeah, I just feel calmer. Like I said, I keep saying relaxed, and I love coming into places like these.
But it's not just for the patients. Staff have been using the installations too.
30 seconds, a minute, and you sort of glaze over with the eyes and experience the sounds, the separation, let's say, from your day really makes all the difference. Having some time to turn off your brain, to reset and refocus, invaluable.
The hospital installations are smaller versions of the original Submergence, which has been on display in Bristol recently. This has been seen by millions of people around the world and created by the Cheltenham Art and Technology collective Squid Soup, who have partnered on the project with the NHS in Gloucestershire.
It's humbling more than anything else, and it's really quite awe-inspiring because when I joined Squid Soup, I never thought that we'd be one day having a conversation where we can look at how our work can get into these spaces and get into these opportunities to make people's lives different in that way. A lot of people look at art and go, as wonderful as it is, what's the purpose of it? But we like to look at how our technology and art together really can expand the spaces that it can exist in, and also the purpose that people think it exists for.
The early signs are positive that Submergence is helping to calm and relax patients, and it's already attracted interest from other healthcare providers across the country. It's hoped that this study will now lead to a bigger project to make installations like this permanent, to immerse patients in art and technology as a complementary therapy. Steve Knibbs, BBC Points West, Cheltenham.